Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician, and we are revising Aconite Nepalus. And this is part 1A, which is specifically we have designed to deal with clinical application of this remedy. The text is from Helen's Keynote, and let us see. The first clinical condition is generalized anxiety disorder. General, Generalized anxiety disorder is a vicious circle, and this can be the one of the very important constitutional remedies. Though it is a short-acting remedy, but it is a first remedy to be thought of. There is a great fear and anxiety in mind with ailments. Life is rendered miserable. That is what Ellen tells us. Anxious, restless, do everything in great haste, must change position often. Everything startles him. Music is unbearable, makes her sad. Next clinical condition stands here is acute panic attack. We have lot many symptoms as you will see in this particular diagram. So it is a very specific diagnostic remedy for such condition. The panic is sudden paroxysmal, unpredictable attack of severe anxiety, which is accompanied by severe physical symptoms. Onset is abrupt. During attack, you will find episode of intense fear, fear of impending death, great apprehension. There will be hyperventilation, smothering sensation, choking, and dizziness. Unsteady feeling, faintness, trembling, shaking, nausea, abdominal distress, chest pain, palpitation, and sweating can be encountered. The duration is about reaches the peak within minutes and may last for minutes to as long as 2 hours. The after attack patient may continue to feel agitated and fatigued for several hours. In between the attack, patient is free from anxiety. The next clinical condition we have is agoraphobia. Agoraphobia is fear of closed spaces. Aconite is a very specific remedy for that. It is a type of anxiety disorder where being in situation from which escape might be difficult or avoidance of situation, being alone outside one's home, traveling in a car, bus or airplane, or being in a crowded space excite this kind of anxiety. The next clinical condition is hysterical blindness. Suddenly patient complains that he can't see anything. So it is also a very specific remedy for such sudden attack. Suddenly patient can't see. On examination, ophthalmic examination, you will find there is nothing wrong with the retina, and on closer scrutiny you will find that it represents a somatoform disorder, a kind of conversion phenomena. The next clinical condition is nightmare. We find dreams, intensely frightening dreams. What is the dream content? Let us see. That threatens to survival, security, or self-esteem. Dream recall is patient can recall the dream on awakening. Once early morning gets up, he can recall the dream. The episode causes marked distress. At times, patient can awaken from the sleep while he is still dreaming. He is frightened and becomes rapidly oriented and alert. After some time, Time of sleep cycle, you will find such dreams. They occur during REM sleep. The most common time is one third of the light sleep in which we go into the REM sleep. This is the last one third of the sleep, night sleep. As a specific remedy, nightmare, nightly ravings, anxious dreams, long dreams with anxiety in chest, starts up in sleep. These are the lines taken up from Boericke Materia Medica. Next clinical condition we have is tonsillitis. It is a specific medicine for acute congestive stage of tonsillitis. Causation is exposure to cold wind or cold air. Situation or pathological status is the first stage, congestive stage. Symptoms include soreness of throat, difficulty in swallowing or painful swallowing of the food or drinks, pain in the ear, headache, malaise, tiredness, and signs include when the whole tonsil is uniformly congested and swollen, it is called acute parenchymatous tonsillitis. The next important condition we have, clinically speaking, is the croup. And this is a specific remedy in case of croup. To start with the medicine, to start with the treatment you say, horse dry croup cough, croupy cough, loud, labored breathing, child grasps at throat every time he coughs. The cough is worse at night and after midnight, usually caused by exposure to dry cold wind or weather or draft of air. Clinical aspect is age is usually 6 months to 3 years. Causes include viral allergic conditions. Symptoms is barking cough, hoarseness, inspiratory stridor is classical, fever may be low grade. Next clinical condition is trigeminal neuralgia. Out of trigeminal neuralgia, we have ophthalmic branch, maxillary branch, and mandibular branch. Generally, you will find the maxillary branch is most often affected. Aconite is one of the very important specific remedies. There is sudden, severe, brief, stabbing, lancinating, recurring pain in the distribution of one or more branches of trigeminal nerve. Trigeminal nerve is also known as prosoplegia. It is an old terminology which we'll find in our homeopathic repertories and materia medica, and is a neuropathic disorder. Neuralgia, especially of the left side, with restlessness, tingling, and numbness, pain in jaw. This is a symptomatology which is taken up from Boericke. Next clinical condition is pneumonia. It is again a very specific remedy, best suited in the first stage of pneumonia. We have high fever preceded by a distinct chill. The pulse is full, hard, tense. History of exposure may be taken into consideration. Dry cold wind. Next important clinical condition is earache, acute earache. In this condition, Aconite is very important remedy. At the onset of ear symptoms, external ear is usually hot and painful, especially in case of children. They have throbbing pain after exposure to cold and they are hypersensitive to noise and music. They may also have dry cough and congested nose. They tend to have increased thirst. Another clinical condition is pleurisy. It is inflammation of the pleura, aconite being the first remedy. In cases of pleurisy with chill, high grade fever, it is only useful in the first stage before the exudation takes place. There may be sharp stitching, dry chest pain because of intense congestion, and it is worse by respiration. Another condition which is very important is angina of effort. Aconite can be a very specific remedy in case of a stable angina. Ischemia is due to fixed stenosis of one or more coronary arteries. Onset is sudden. Condition is precipitated by strenuous exercise, ascending stairs, exposure to cold, usually after meals, emotional excitement, and sexual intercourse. The characteristic of chest pain includes it is a substernal heaviness which may radiate to left or both arms and neck. It attains maximum intensity within seconds. Sensation of operation constriction and vise-like cage-like sensation is there. Aggravation from continuous physical activity. Amelioration by absolute rest. Generally, when the patient takes a rest, the duration is not more than 5 minutes. And associated complaints at times you may find sweating, vomiting, dizziness, and choking sensation. The next important condition which we are going to have information is facial paralysis. Again, aconite is the first medicine to be thought. Bell's palsy is facial paralysis of acute onset due to affection of the facial nerve. It is a motor nerve of the face, supplies the muscles of expression. The nerve comes out from stylomastoid foramina and it may occur at any age, from infancy to old age, but appears to be most common in young adults. Males are affected most common than females. Aconite is the remedy if onset is from exposure to dry cold winds. It presents a classical lower motor neuron type paralysis. Febrile seizure is another condition which is very important for us, and aconite being the one of the very important first remedies. The febrile seizures, the seizure accompanied by fever when the fever is more than 38 degrees Fahrenheit centigrade, without CNS infection are defined as a cause in infants and children who are 3 months to 6 years of age. Average peak age is 18 months to 22 months. Another clinical condition is a postural hypotension. Aconite is one of the very important remedies. We call it orthostatic hypotension. It is also known as postural hypotension. It is a very common type of a low blood pressure and usually transient and represents a delay in normal compensatory ability of the autonomic nervous system. On rising from recumbent position, the red face becomes deadly pale, or he becomes faint or giddy and falls, and fears to rise again, often accompanied by vanishing of sight and unconsciousness. These are the lines taken up from Ellen's Keynote. Thanks. Thank you very much, friends, for your patient listening.